We would like to welcome Dr. Lawrence Polsky today. He is our public health officer for Calvert County, and he's been here about 10 years or more now.
Close to 10.
Dr. Polsky is a board-certified OBGYN, and he has over 32 years of experience in the medical field. Graduated right here from University of Maryland from our medical school, and we are lucky to have him on our team. And once again, I'm Anita Ray, and I am the Grants Program Manager for CCBH. Dr. Polsky is going to give us some insight on how we did and what we look forward to. So the first thing I want to talk about, which is on everybody's mind continuously, is COVID. What would you say to where we are with COVID right now and some of the things that we've learned or gleaned from this experience?
Almost certainly the worst of the impact is behind us. But if we've learned, or if we should have learned anything, it's that this virus mutates in a way that had not initially been expected. And with each new mutation, the impact it has on each of us as individuals and more broadly as a community continues to shift. I will quickly add that the vaccines are still extraordinarily important in preventing severe illness, but they don't prevent people from acquiring the virus as consistently as we saw during the earlier phases. That we still see that for people who are unvaccinated or have not kept up on vaccinations, that they're much more likely to become seriously ill, much more likely to be hospitalized, and unfortunately more likely to die from the virus. There's also very good evidence that for long COVID, which is when people continue to have symptoms, oftentimes severe fatigue, muscle aches, cough, brain fog. For those who were unvaccinated, they are much more likely to develop long-term symptoms than those who have been vaccinated.
What is really the definition of somebody being fully vaccinated?
In terms of what's important for people's health, we have extremely good evidence from multiple studies across the country that as a foundation, as a baseline for vaccination, what everyone should have are the initial 2 doses.
Okay.
And then 1 additional booster dose, which would typically be given about 5 months after the first 2 are given. The less likely we as individuals are to get infected, the less potential we have to spread that virus to others who may end up with more severe complications. When I was still at part of my career where I would operate on people or do other procedures, it was just part and parcel. It's just not that difficult to put a mask on. And again, I look at it not just as protection for my own health, but respect for others that I'm around who may be at higher risk than I am.
For 2.5 years, COVID has dominated everything that we've always done. It's been a huge issue globally. But another issue that we've experienced as well is the opioid epidemic kind of taken a back seat, but it's still here. So one of the things we do know is that last year around this time, I think we had 12 persons that had died from fatal overdoses. This year we have, I think, 10 to date. So we have a decrease in opioid overdose, but it's still an issue. Fentanyl's been the common culprit in the majority of the deaths. Could we talk a little bit about fentanyl and the impact that it's had and the reason why it's so deadly in regard to street drugs?
The biggest difference that we've seen during these last now about 15 years where there's been a clear increase in opioid misuse and subsequently overdoses is that the threshold for what gets people to a point where they consider the reason why they use those substances and what is enough to do them harm to the point of actually being fatal is much narrower with opioids than they are with others, where we still see people die, but either they're more slow motion, like with cigarettes, I will say, still kills an enormous number of Americans, and alcohol, where you can have alcohol toxicity and die. And one of the changes we've seen nationwide over with the pandemic is an increase in fatal liver disease, which is very likely tied in with increased alcohol consumption over the stresses with the pandemic. Getting back to fentanyl in particular, so with the last 15 years of dealing with opioids, we've transitioned through really 3 phases.
Okay.
So it started out with the overuse of prescription opioid medications.
Yes.
People know how many milligrams they're getting, and oxycodone and other types of prescription medications certainly can lead to overdoses, but they are not super potent. So people oftentimes would have to knowingly take large quantities to be at a point where they were going to fatally overdose. Then we transitioned to heroin when the prescription pills started becoming less available and more expensive. Then heroin was a less expensive and more available option. Heroin obviously not regulated, and so we did start to see an acceleration in deaths because people didn't know how much they were putting in their body from use to use. The potency, how much filler, how much actual heroin was in there, there's no way to really know. And then after a few years, fentanyl, which is a completely synthetic product, and it is extraordinarily more potent, so 50 to 100 times more potent than heroin.
And it's still an opioid.
It's still an opioid, and if you take about 100th less amount of fentanyl than heroin, you're getting equal amounts.
Yeah.
So the ability to control how much fentanyl you're actually using is extremely difficult, if not impossible. Although most of my time is spent running the health department, I do spend still some time directly treating patients, and one of the things that I do is for people who are actively using opioids and are looking, to move toward treatment. So I prescribe these medications, and for the most part, my patients do very, very well on Suboxone. If you met somebody who was appropriately taking Suboxone, there would be no indication, there'd be no way for anyone to realize that they were taking this kind of medicine. When you have somebody who's stable on these medications, those families, they have their parent back, they have their child back, they have, and then, of course, more broadly into the community, for employers, they have dependable employees. And so there's, all sorts of positives.
So the quality of life has just improved tremendously.
For some people, coupling medication with behavioral health therapy can be very important.
It sounds just like someone that is diabetic and has to be prescribed insulin for sustainability, and you go see your doctor, an outpatient, you check in with them, you talk about your diet, your life, your lifestyle, what works well, and you determine what's the best thing, and then so it's very similar to anybody with a chronic disease.
Absolutely. It's a really good analogy where just like with substance misuse, that we know that for most people there is a combination of genetic predisposition,
yes,
and also things that happen during their life that they're exposed to that increase those risks and the ability to control it. And the same thing for diabetes. We know that.
We talked a little bit about the pandemic and COVID and talked about opioids. So you all have a new program that's going to launch called The Highway to Health. Give us a kind of like a sneak peek about exactly what that would look like for the county.
One thing that we're looking at is how to better educate people. And so the mobile van will allow, so we'll have nursing staff and community health workers on the van that can reach out to groups across the county. So if
Awesome.
There's anybody listening in who, for their civic group, for their church group, for whatever organization that they would like to have some of our staff come out and give a presentation. I think part of that is the ability for people to ask questions. Part of our COVID work at the health department, we certainly worked much more closely with a lot of the private practices, actually all the private practices in the county, everything from pediatric practices on to doctors who do geriatrics. And so we see this program as an ability to directly outreach to members of our community who would benefit from programs and services, but also realizing that if we don't bring in the nurse practitioners, physicians, physician assistants who are caring for people, that we're not really going to get the maximum benefit out of what we can achieve.
You deal with both sides, the physical health piece as well as the behavioral health piece. So if there was really one thing important that you want to share about public health or the health department that would be beneficial to the community, what we would like to share today with them?
Maybe we should have little mini kind of health assessments, maybe on a monthly basis, where we set out what hopefully would be an achievable goal. And then maybe at the end of the month, just take a look back. Were we successful? If so, how can we build on that? And if not, what did I as an individual learn? Why? And keep in mind that for most of our important health goals, what we're looking at is a couple of years down the road, are we healthier physically, or are we healthier emotionally than we were before? Just short-term gains or short-term losses are not as critical.
Thank you so much, Dr. Polsky, for joining us today.